I'll tell you how I do it. I'll use the bloody bit, so you can't sponge me. Okay. Now, I'm just going to, the patient, of course, often have complained about tingling or numbness or something in their face. So I say, right, you've had some trouble on the right-hand side. How does that compare to that? So I'm comparing, like dermatomes, really. How does that? Okay. And then, can you take your glass off a minute? And then just tell me, so this is a little bit reduced compared to that. Tell me when it gets sharp again. And he says, it's getting sharp because we're in maxillary. Because some trigeminal lesions affect ophthalmic, but not maxillary, not mandibular. That would suggest probably branches on the way out through the skull, rather than anything more central. Okay? Now, the other thing that I could mention is regards a bit of neurosurgical sensory. You're never going to do this, I suspect. But with acoustic neuromas, I may show you a picture of that in a moment, the tumour growing on the 8th cranial nerve, it actually tends to, early on, by which time the patient is deaf, by the way, affect the ophthalmic division of trigeminal, and the thing they lose is corneal sensation. So I get a wisp of cotton wool, which I should have brought with me. I then come to the patient and I say, look, I'm just going to go straight ahead, and I touch the patient with a bit of cotton wool, almost from the side, so they don't see it. And the absence of a corneal reflex tells me they've got a little bit of early sensory loss in the ophthalmic division, corneal, of their trigeminal. Whereas, in fact, touching with the cotton wool, they probably won't have anything. So it's an early sign of the ophthalmic division being affected, as in acoustic neuroma. That has particular clinical significance in a way, because when we operate upon an acoustic neuroma on the 8th nerve, we're in great danger of causing facial weakness, because the 7th nerve is near 8. Now, the worst post-operative situation then is a patient who's actually got a diminished corneal blink reflex and has a Bell-style palsy, because now they can't blink and put the lacrimal fluid over their cornea. And within 24, 48 hours, a patient like this will develop a corneal ulcer. And we actually have to do a thing called tarsorrhaphy in a patient like that. We get the eye surgeons to help us, or we do it ourselves often, and we close the eye 3/4 or half, to stop that happening. So corneal sensation and facial weakness are an unpleasant combo, because you'll get corneal ulceration. Thanks. Excellent. Facial. I have a certain personal feeling about this. I think I mentioned it once in one of my talks. I did, didn't I? Because I had a parotid tumour when I was a final year medical student. I had it even before then. So I had, as a registrar, come senior registrar at French, parotid surgery. And the plastic surgeon he was a wonderful plastic surgeon, was rather cross with me because he said I'd left it far too long, and he had 8 hours of dissection to save my facial nerve. So one of the important bits of anatomy for a head and neck surgeon or a plastic surgeon, whoever does parotid surgery, is to remember the close relationship of the 7th cranial nerve. How has the 7th cranial nerve got out? It's got out through a little hole in the base of the skull called the stylomastoid perineum. Right? So it's come out there and it goes through the parotid, then it divides into the so-called goose's foot, or the pes ansinus. And there we are. Now, a few things about facial nerve. First of all, lower motor neuron facial palsies, like this lovely old drawing, affect the whole of the face. So, classic Bell's palsy, which is usually a lower motor neuron 7 coming on spontaneously, we think connected with viral infection, affects the whole of the face, of course. Okay? Whereas because the upper part of the face has bicortical representation, and we mentioned this last week, the upper part of the face in upper motor neuron facial nerve problems, as in a stroke, protects eventually, and when the patient's recovering, they usually manage to have movement of the upper part of the face, the forehead, the wrinkling of the forehead, the closing of the eyes. The other thing that the facial nerve does, of course, is supply the tongue with the anterior 2/3 of taste, and has has that got any particular significance? Probably not in terms of actual testing. It's very difficult to test taste, actually. I can tell you how to do it if you want to come down afterwards. What else does it do? It also has some funny effects in that it has a little bit of sensation around the ear. So as well as being a motor, it has a little bit of a sensory function as well as regards the ear. And it's also, very interestingly, has a little supply to a little muscle called cauda tympani. And what is the purpose, what is the significance of that? If you actually get a lower motor neuron facial Bell's palsy, you might have hyperacusis, because when there's a loud noise, your cauda tympani contracts your eardrum. It's a loud noise reflex. And so because you haven't got that, loud noise sounding even louder. And some people with facial weakness say everything sounds loud in one ear. Hyperacusis it's called. I think it's a bit of a bad name, hyperacusis, but that's what it is called. And that's just a corollary of this little muscle being affected. Anything else we can say about seventh? Oh yes, yeah, back to me. So when I had my carotid surgery, I woke up with a facial palsy. You can imagine a neurosurgeon, I said this last week, with a facial palsy, it's like, worst sort of death, I think. Well, within 3 or 4 days it cleared. 3 years went by. The plastic surgeon who did it, I was a consultant in Aberdeen by now, but I was a senior reg in Bristol, and we came up for this big meeting called BAPS, British Association of Plastic Surgeons, and I was invited to sit next to him. Well, actually, I did a little bit of dealing, so black tie on, and I had this wonderful meal next to him. He said, Terry, he said, you've never got any problems with Frey's syndrome, have you? Which I'll tell you about now. I said, no. He went home on the plane. Next day, it started. I had a curry that next day and started to sweat down one side of my face. Honestly, the next day, and ever since, I've got sweating down one side of my face with spicy food. So when I go home tonight, I'll be absolutely starving. I'll have a little glass of wine, I hope, from my dear wife waiting for me. And, sorry about that. Sorry about that. And you'll have some tasty pasta, and I'll start sweating a little bit. Not very much. Why should that be? Because what is actually happening is that the facial nerves, which also supply parotid salivary secretion, are now falsely re-innervating the sweat glands in the face. And that's called the auriculotemporal sweating syndrome of Frey. F-R-E-Y, who was a Polish neurologist who, very sadly, I found, was actually murdered in Auschwitz. But she, bless her, she collected 7, 8, 9, 10 cases of this and written it up. And it's incredibly common after carotid surgery. I've now found that out. Okay, the hard way. I couldn't care less about it, really, you know. But occasionally I'm seen to gag my face. Okay. Funny things about the facial nerve. And the anterior 2/3 of taste. What's the posterior third supplied by? Glossopharyngeal. Okay? I can tell you how you test taste if you want, but I don't often do it. It is of some use for me anatomically to know where the facial nerve lesion is. So if, for instance, fractures of the skull in this region here can cause facial nerve weakness. So there is a very big bone, or not very big, in the base of the skull, called the petrous bone. Why is it called petrous? Because we get the word Peter, rock, on this rock I found in my church, it says in the New Testament, petrous. That area has this in it. So this is petrous bone, the middle ear, and the facial nerve. So fracture in this region from base of skull, you might get a Bell's palsy, and you might certainly get disturbance of the vestibular apparatus. Do you remember that slide way back where the lady had the raccoon panda sign? A fracture here will give another hematoma sign. Do you know what it is, anybody? Battle sign, bravo. And that sort of patient might well have also facial nerve weakness.